welcome to my conversations. And today we're going to be discussing something that we hear perhaps use as a word often in our conversations to describe ourselves, to describe others, but actually has a very deeper clinical meaning to it. And yes, we are going to be talking about OCD today. We have our guest, Mr. Khushal, today with us. If you could just introduce yourself.
Yes, I would say that I have been working for the last 7 years, primarily in Nasik city, but
Yeah.
I also take some online sessions, clients from abroad, and I work with adults mostly, and you can say early adults or late adults, and I'm very comfortable working with client who are having mood disturbances,
Yes.
anxiety, or you can say more specifically clinical topic like schizophrenia, OCD, bipolar disorder, personality disorders, and there are many. So that's how things happen with me. Yeah, apart from that, I like music, I like doing art work, I really like setting up aquarium, and you would see my cabin, you will see all of this
Yeah.
already happening. So that's
Awesome.
more about me.
Awesome. Thank you for sharing and thank you for being here on my conversations today to talk about OCD. Um, when you hear, when a lot of people hear about OCD, what is the very first misconception that you'd want to erase?
Okay. So what I have noticed, over the period of last few years, because of this social media platforms, many mental health professionals have been advocating about certain conditions like autism and OCD. They have been frequently cited or talked about, and people cannot help but relate to certain things. And the one thing that happened here is how people relate themselves with cleanliness or tidiness or organized behavior,
Absolutely.
that they feel that they're having OCD, right? But
Yes.
OCD is not very limited to that particular thing. It's more than that. There are many types, various types of OCD, and the way it reflect, the way it affect your day-to-day activities. I think that is something people should know more about before
Absolutely.
they say that they have OCD.
Absolutely. So, like you mentioned, Kushal, that it's usually connected with cleanliness, organized behavior. If OCD is not about being neat or about liking things a certain way, then what is OCD at its core? If you could just help us understand.
Okay, so that's one thing that everyone has to keep in mind when they think about OCD. It's not something the person wanted, right?
Yeah.
So it's what we say, it's ego dystonic,
Mm.
meaning that they cannot help it, but they see something, they do not want to clean it, they don't want to check, but they cannot help and repeat that behavior again and again. And it's very intrusive for them. They cannot help it. It's not like you
Yeah.
can say to them, "Ki, control it." It's
Mm.
not like that. And because it's something they are not able to control, they feel very helpless to do certain things
Yeah.
their mind asking them to do. And I would say it's very exhausting for the person. It
Yeah.
affects their daily routine, it affects their relationship, it affects their work, it affects their social behavior. You can see the impact of
Absolutely.
OCD everywhere happening with the person. So it's not limited to just cleanliness.
So, like you said, that it's out of their control. It's not something they can entirely, stop. How do we differentiate between people just saying that I just need this like this, or I have to do it, and people actually being able to say that I cannot manage if this doesn't happen? Where do we draw that line? How do we draw that line?
So I would say at certain point one may want to be perfect or represent certain things the way
Yeah.
he or she may have in mind. I would say understanding that, and to make certain modifications, or if by externally or somebody is suggesting कि बस हो गया है,
Hmm.
maybe now you shouldn't worry much
Yeah.
about this, it's okay, this is fine. So I would
Correct.
say they are a little flexible in their thinking pattern, and they can adapt to the instructions
Yeah.
given by others, and they can stop themselves. So that's a thin line here.
Makes sense.
I would say.
Absolutely. Can you walk us through, what an OCD cycle actually looks like from the first intrusive thought that I need to do this or I need to have this to the compulsion where they cannot stop that sort of cycle and behavior?
Sure, sure. So, like, I can give you an example of somebody I'm working with already.
Yes.
I won't be disclosing details, but this particular male client who is around 34 is married, and he cannot help but when he reaches his office and he feels that, oh, it's an office desk. Many people might have touched it or something like that, and he would look at it and he will feel that it's dirty, and he would want to get that urge to clean that.
Mm.
Okay, so there's a thought, it's happening very spontaneously. It's not like he's thinking about it when he's going to
Yeah.
reach office. He's reaching office, he looks at the table and he sees there's a contamination. Maybe people may have touched it after he was gone, and now that thought that maybe it is touched by somebody and it is contaminated,
Yes.
he, even if he tells himself, oh, it's okay, I will not clean it today,
Yeah.
his mind will again come back to it. And his mind
Absolutely.
will tell him, you should do this, you should clean it. It's not clean, it's dirty. And if I don't clean it, my hand will touch there. If my hand touch the table, it will get dirty. If it gets dirty, my phone gets dirty, my pen gets dirty, everything gets dirty.
Mm.
So it's the fear is of contamination is also spreading now.
Yeah.
So the person feels like, if he can clean the table, he won't have to think about it again.
Absolutely.
And that fear draws him to act or to reduce that anxiety, that what if it is contaminated. That
Yes.
anxiety gets reduced when he cleans the table. And now for a while, this what happens only for a while, he feels at ease. Okay, there is no dirt, things are okay. But again, this happens after some time,
Yeah.
right? If any unknown person come touch the table, he would start wondering, oh, कहाँ से आया होगा,
Yes.
कहाँ पे हाथ लगाया होगा. So many things.
Yeah.
So this is how usually the OCD cycle works. A thought comes or an urge comes
Mm.
to do something, or maybe the image pops up in
Yeah.
your mind that this is dirty, and then followed by a behavior that makes you to do something that you are afraid of, like to clean, and then for a while you feel good, and again it's repeat. That's how the cycle goes on.
Makes sense.
It's
So,
rewarding for the person.
yeah. So when we talk about this rewarding and this entire cycle, it makes me wonder that how does a person even recognize that, okay, maybe I have OCD, you know? Like
Mhm.
where does it start? Does it start very young in age or it can start anytime? But how do these thoughts sort of, make you think that, okay, perhaps I need to visit a psychiatrist or I need to go to a clinical
Mm.
psychologist or
Yeah.
um, just help somebody who can help me understand why and what is happening.
Sure. I would say this depends from person to person and what kind of OCD
Yeah,
he or she is having. So, like, there are certain thoughts, there are certain OCD symptoms that are very much visible. Others can see them and then they can point it out because it is affecting them. It's like you have to go to some function and the person is washing their hand again and again,
yeah,
cannot help but get ready and like pay attention to details, and others are getting uh, late, I mean to say. So they're like always coming back to this person and telling, no, there's something wrong, there's something wrong.
absolutely.
So when it about cleanliness, I think person knows it very well, uh, has a good insight. OCD is
Yeah,
that condition where the person would never say ki, I don't have this,
mm,
they will accept that they are having this symptom.
makes sense.
But there are certain thoughts, there are certain OCD symptoms which happens only in the head and people cannot see it,
Yeah,
and the person also cannot share it because they feel very
absolutely.
guilty of having those thoughts, especially some, I would say, religious obsessions or sexual
Yeah,
obsessions that people are having. They
mm,
are very ashamed to talk about it, and they feel very
right,
guilty about it, so others cannot see them. But it's definitely very painful and very distressing for the person.
I'm sure. So that makes me ask, what is something these people who have OCD and are living with it on a day-to-day basis, what is something that people on the outside might never see. Like some of those things become, like you mentioned, the religious beliefs or the sexual beliefs and urges that they have that are very particular, and which they're embarrassed to say. What are such other things that that go on inside their head but are not very visible outside?
I would say the first thing itself, what we say, the sense of agency, it's not in
Yeah,
their hand. It's not in their hand. But people around them feel like, it's not that a big deal. Just you just have to wash it once.
correct.
Why is it so hard to not understand that part?
Yeah,
Like you were not like this before, so you know how to do it.
correct.
Don't act like dumb. Don't behave illogically. Are you doing this? Are you doing this purposefully or something like that? So they cannot see the distress I was talking about some time ago. Like it's
Yeah,
so distressing for this person because they don't want it. They're not choosing it. They can logically say that, oh, I know I shouldn't be doing this,
absolutely.
but it is so hard to tell somebody that I know, I understand, I don't want to do this, but they still
Yeah,
end up doing it, right?
yes.
So so people find it very difficult to
Mm.
really understand that it's not a purpose driven behavior.
Yeah, makes sense. Makes sense. So, would it be fair to say that OCD is less about the fear, but also slightly leaning towards the inability to understand and manage uncertainty that comes with what will happen if I don't? And, how do we explain this to somebody who hasn't experienced it? The thought, the distress, how do we explain it?
I would say it's very difficult to explain to somebody, um, about this because I have been working with OCD client for the last 7 years. But
Yeah,
sometime when people with OCD or their family member comes to me, I
yeah,
cannot help but just see that there are certain caregiver burnout that they're experiencing. But
absolutely.
I will come back to this. I want to address the fact that the fear of uncertainty is there.
Yeah,
Okay, so it's also a fear, and it's also a fear of uncertainty. If I don't do this, what may happen?
yeah,
And I'm not sure how this may turn against me, so I better do this behavior.
yeah.
Okay, so it's definitely there, but some of them have a quite good insight after taking therapy or medication, and they can control much of their behavior.
Hmm.
But the
Yes.
fear persists that I know things won't happen in in such exaggerated way that I may have to face the consequences. Some of
Absolutely.
them may make them ready to face the consequences. For example, like if I don't wash it my hand for 30 minutes, my hands will be dirty, I will catch some germ, I will catch some infection, I will have be hospitalized, and I will be treated. So they know the fact that the last point is treatment, and
Exactly.
yet they do not want to go through this all the thing. So they end up doing the behavior.
Yeah.
Right? So both the part, certainty is there, sometimes
Yeah.
uncertainty is there.
But the fear persists. I understand.
Yes.
Uh, that also makes me, ask you about the flip side of it. When you said that yes, medication helps, therapy helps, perhaps not control it entirely, but manage it in a better way. See, okay, if it was happening so much or with so much intensity, it's reduced.
Yeah.
So, when someone with OCD finally reaches out for therapy, especially therapy, not just medication, what usually brings them there? Is there a common moment that you have seen between all of your clients, or are there particular realizations that they've had, any aha moments that you would like to share?
Again, it will differ from person to person. For
Yeah.
some, the realization comes even nobody has noticed it,
Yeah.
when they can see that it is not them or they were not like this before, and it is so annoying or so frustrating for them that they are sick of it and they are
Mhm.
tired of it, so that it has crossed their window of tolerance. So
Absolutely.
sometimes it is them. Sometimes when they see that okay, the problem is now affecting people around me, or it is
Yeah.
affecting my relationship. It could be marital relationship, or it could be
Yeah.
romantic relationship, where, or it can also be a relationship with parents, where they're
Absolutely.
constantly uh, saying this person, like, you shouldn't be wasting water, or you shouldn't be doing this,
Yeah.
and it is affecting the whole family environment. It is that. And the third part, I was talking about this particular client. He was somewhere, he has this 3 years old daughter, and he's
Yeah.
afraid that now she has started behaving or copying his behavior,
Hmm.
and he doesn't want that to
Okay.
happen with her. So in order to prevent that, he showed up for therapy.
And
So it differs from person to person.
makes sense. But I hear you. A lot of it encompasses family, affecting others around them. I know just that realization that perhaps I need to work on certain things. Uh, awesome. So for someone who's, listening today and who's silently wondering that could this be me, because a lot of times this happens, where we are reading something online and we're hearing somebody else's story, and we're just consuming a lot of media these days, and we feel that, oh, it could be me, oh, even I behave like this. Especially with circling back to what you said at the start, a lot of awareness has increased, with people posting more about it, talking more about it, even uh, professionals bringing in their point of views, psychoeducating, increasing awareness in multiple different ways. Anybody who's listening to us talk today and thinking, could this be me? When we're
Mhm.
talking about the symptoms, when we're talking about the behaviors, what is something that you would like them to know before they leave this conversation, or before, they look up something on Google, uh, or start going into a spiral and overthinking of, oh, what? What is something you'd like to share with them?
Well, I would say that, reach out,
Yeah,
talk, and get help, because it really, I have seen the change happening
yeah,
even from like as early as 15, 16 age, from till 50, 55. I have worked with all of them. I have seen them from the starting session. I have seen them at determination
yeah,
session, and that I have seen that how relieved they are feeling, or they have felt. And it takes time.
mm,
Therapy and medication takes time, I would say. Be patient with therapy. Speak with your therapist or your psychiatrist about, if you're not happy with the treatment, if it
yeah,
is not working in your direction, go for second therapy session, ask for second opinion. That's absolutely okay. And the therapists will do the needful. They will try their best. Sometimes it may not work for you, but that doesn't mean that OCD cannot be treated. It can be treated, and you can live with OCD with, definitely, with medication and therapy. You can function, you can have a satisfactory relationship, you can have satisfactory work, everything, right? So the help is there. You just have to reach out.
um, we've covered quite a lot when we talk about OCD, experience of it, understanding what is not OCD. Um, just one important question that we are consuming so much media with raising awareness of mental health and mental well-being, and diagnosis and mental health assessments, all of this. A lot of media has also started portraying more of all these diagnosis, therapy sessions, psychoeducation, mental health, and mental illnesses in the movies, TV shows, series that we watch. Uh, what is something that you would like to share which is very different what is portrayed in media when it comes to OCD, and what is actually going on behind or within a therapy room?
um, this is something very interesting, because very recently one of my client pointed out that, how he thought that therapy would be versus how therapy is.
Yeah,
And well, I would say when you watch something on television, or on media, the characters, you see them, or it's everything is scripted. They are well trained to show their emotions very well,
yeah,
right? But when it comes to real life, you may see it very differently, including how your therapist behave inside the therapy room.
Absolutely.
And I would say that the therapist sometime would be very neutral,
Yeah.
right? And so for some people it may feel like, maybe my therapist not completely into therapy, because I haven't seen the way, I have seen the different ways
Yeah.
people work as a therapist in movies and everywhere, but this is my therapist
Mm.
seems very cold to me, right?
Absolutely.
So I would say every person has a different personality. Your therapist may have certain strength and may lack certain skills
Yeah.
when it comes to taking therapy. So he or she may have his way or her way to take therapy.
Yeah.
Give them time, understand them as a person, and not somebody who is, I would say, professionally actor or something. Like, they may sometimes lack emotions to show
Yeah.
how they are feeling for somebody, and the person may misread that, okay, my therapist is cold.
Yeah.
Again, when it comes to depiction of certain OCD symptoms or
Yeah.
other conditions, I would say that some of the media do well research about how it actually looks,
Yeah.
and they really try to show the impact it may have on person.
Absolutely.
But some at some places the symptoms are quite exaggerated, or maybe I would say limited. Just like we were talking, neat or tidiness,
Correct.
that kind of OCD is very frequently portrayed or talked about
Absolutely.
on media. But I would say OCD is not limited to that, as we have talked, and there's more than this, and people are struggling with it. Initially, when I started working as a professional, I thought that uh, identifying OCD is very easy,
Yeah.
right? But as I started working, I started understanding that no, 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 it doesn't go like that. Sometimes the symptoms are very unconventional, right?
Yeah.
Or that you don't really see. I have seen people telling me that if I don't read something again, I'm afraid something bad will happen. And somebody who is very new to profession may not be completely aware that what the person is talking here.
Yeah.
Okay, and they may consider it some just anxiety, but it is more than that, like,
Absolutely.
and the person is rereading or rewriting or stepping inside the house with left foot first and then the right foot or something like that, the
Yeah.
certain ritual behavior that person may have in mind, or the fear of harming to others. That is again another form of OCD that I have noticed having people having, but nobody's talking about it.
Yeah.
Fear of what if I am on the top of mountain, and what if I push somebody, or the stranger or my friend or my family member, and what will happen to them? Or even mothers having this fear of harm to their babies. They don't want to do it, but the baby is in their hand and they're standing height at great height, and they're having this thought, oh, it just crossed my mind, what if I throw my baby down?
Yeah.
They don't want it, they're not thinking about it, it's very intrusive, they're not
Absolutely.
planning about it, so
Absolutely.
it's intrusive. So people have to understand that sometime sometime you may get these thoughts and they're very recurrent,
Yeah.
and you cannot help but think about them, stop them. So you should seek help.
Absolutely. Thank you, Kushal, for all the lovely experience and knowledge sharing when it comes to OCD. I feel these conversations become important, not just to understand what these certain mental health terms are, but also to understand what they are not, or what are they beyond what
Yeah.
we see just on media, right? Because you very correctly pointed out that we usually, yes, we do just see OCD as, tidiness, wanting things organized, having a neat behavior. But there's so much beyond that when it comes to OCD. And the crux of it all is intrusive thoughts, not being able to stop that compulsion. And I absolutely hear you. Ending it with a last question that we ask all of our guests, and it is our favorite, and the viewers' favorite, is that what is something that you feel everyone listening should be comfortable with or should get comfortable with?
Okay, so it's a very general question. You're saying, what is something the people would want to know about what they should be comfortable
What they
with?
should be comfortable with or about. Yes.
I guess because we're talking about mental health, and many people out there are struggling, and some of them are holding themselves back,
Yeah.
thinking that I'm strong enough to deal with this,
Yeah.
alone. I would say that's not being strong, and you're getting it wrong. Being strong is showing up, talking
Yeah.
about what is bothering you,
Absolutely.
and seeking help whenever it is required. And I would also say, be comfortable with who you are, the way you are. First, maybe like we try to please others, we try to win approval of others,
Yes.
and we do all those things. I would say, let's start with you. You need that. You need to accept the way you are, and it's okay if not everybody likes you. That is
Yeah.
fine. And be kind to yourself, because people don't do that. They are very trained to be
Yes.
kind to others, but when it comes to self, they also have to learn to be compassionate with self.
Yeah.
And I would say all of these things takes practice and intention to do this. It's deliberate practice that you have to take time out for this, reflect on this, and work on this. And I would say much of your um, anything that you're struggling with, be it relationship, be it your work, or anything that is bothering you, you will see yourself far more resilient than you were before this.
Yes.
So yeah, that's something I would say.
Thank you for sharing that. So important, intention and practice. Practice alone doesn't suffice, and intention alone doesn't suffice either.
Yeah,
The
yeah.
both together become important.